Welcome to this AJR Insider video. I'm Andy Rosenkrantz, Editor-in-Chief of AJR, and I'm here today with Dr. Jonathan Chung, Professor of Radiology at UC San Diego, who is editor of our Cardiothoracic Imaging Section. In this video, he'll be sharing with us his insights about the area. Jonathan, thanks for joining us.
Andy, thank you so much for having me. I'm very excited about this.
Can you tell us about your background in cardiothoracic imaging?
Well, it goes back to residency, really. So I did residency up in Seattle at UW. And so my attendings there, they really got me involved in projects and got me excited about cardiothoracic imaging. So I'm just going to do some name dropping, Dr. David Godwin, Dr. Pipovac, Eric Stern. They really were good at mentoring, and made me feel like I was really part of the team. And then when I went to fellowship, really the mentorship changed the trajectory of my career. So I had wonderful mentors at MGH as well. People like Dr. McLeod, Dr. Joanne Shepard, Dr. Sunny Albara, Dr. Dugamarthi. And so they gave me projects, gave me opportunities, and also just, again, made me feel like I was part of the community. And then when I really hit my inflection point, I think was actually right after my training, right after fellowship, I started at National Jewish Health in Denver, working with Dr. David Lynch. And I always loved interstitial lung disease. That's the main reason I became a chest radiologist. It wasn't for the metastatic disease workup. It was definitely for the interstitial lung disease. And there I learned so much about interstitial lung disease, unlearned some things that probably were not quite right, things that I had not learned correctly. And it was almost like doing a second fellowship. It was great. I mean, albeit it was 5 years long, and at least I got paid like an adult. That was nice. But seriously, I learned so much there. So that's pretty much my background in terms of cardiothoracic imaging.
Let's move on now to the journal section. What trends have you observed for recent AJR submissions in this space?
So in the past year, there's been a huge wave of AJR submissions about artificial intelligence and large language models. And it makes sense why. So these are hot topics. Radiology is quickly evolving to understand how we can use these tools practically. So we're exploring, and that's what we do in radiology. We're on the cutting edge of tech in medicine. So it just makes sense why there's so many papers in this regard. I've also noticed, very pleasantly surprised that the sophistication of manuscripts has also clearly increased in the past few years. And so it's not like we've been necessarily pushing for this to happen, but it's just happening organically, which is an amazing thing. So very rare are the simple submissions on descriptive studies. Again, back in the day, there was room for that. There was obviously a role for these kind of papers, but now that the literature is becoming more mature, descriptive studies probably have less of a role. And so we're seeing fewer of those, rightfully so. And then lastly, and for me, thankfully, papers on COVID are now nearly non-existent. And why is that? It's because COVID is quickly becoming less practically relevant to us. Fewer people are getting really sick from COVID. Like many people are still getting COVID, but hospitalizations and deaths from COVID are really, really not common anymore, right? Very unusual. So thankfully, we're not getting as many of those papers because, again, COVID is less of a practical issue.
So thank you for those perspectives. What do you see as areas of priority for publishing in cardiothoracic over the coming year?
So I think if we think about the main priorities of the journal, so number one, to support the overarching goal of the journal leadership to publish and invite content that will be valuable to our readership, number one. And then to publish high impact scientific papers that are timely or rapidly evolving that will push our field forward. I think that those are sort of the priorities of the journal and really of our section as well. I will say one topic that I would welcome would be seeing more papers discussing how we could use AI, artificial intelligence, or large language models in other automated approaches. For example, in setting of like quality improvement or workflow improvement. A lot of the AI papers that have been created have been imaging based, and rightfully so. We're radiologists, we're imagers. We look at a lot of imaging, but I feel like we're just scratching the surface in terms of quality improvement and in terms of workflow improvement and process improvement. There's a lot of opportunities there in using AI and using LMs in particular to do some great things. We haven't sort of gotten to that level. Some people call quality like research 2.0, right? Sort of like kind of next level. And so I hope in the next coming years, we will see more research in that regard.
Yeah, I totally agree. There's so much opportunity to do new things with AI beyond just traditional interpretive tasks. And likewise, I'd really look forward to those submissions. So What tips do you have for authors looking to publish in cardiothoracic imaging?
That's a great question. So I don't know if everyone is aware of this, but we have multiple steps in a review process, but sometimes papers don't even go to review. We call this reject without review, right? And so why are these papers rejected without review? I think most of them don't pass the basic litmus test of any decent manuscript, which I like to call in colloquial terms, the so what test, right? So does it answer the so what question? Because if it doesn't answer the so what question, it's probably not going to get through, right? So for me, this is a straightforward but crucial standard. If a reader can't identify very quickly in a meaningful way what the takeaway or purpose of that study was, that paper was, that paper is probably not going to get accepted. It's probably not going to get past that stage. And so papers that don't meet this test often get rejected, again, even before it's sent for review. And sometimes when it gets sent to us, I wonder to myself, boy, there's a missed opportunity there, because sometimes the data or the results in that paper aren't bad. It's just that the approach was not quite right. So they weren't starting with that so what sort of question. They were just kind of presenting the data. So it's a missed opportunity. So at the core, every study should have a reason for existing, a practical takeaway, again, unique insight that adds value to radiology. So will it help us with diagnosis? Will it inform therapy? Will it inform prognosis? Will it help us in some way, maybe understanding the underlying pathophysiology? If it doesn't answer one of these basic so what questions, then it probably is not going to be accepted. And one questions whether you need to write that paper.
You raise a really great point. I mean, sometimes we may have the submission that the study was well executed and the paper was well written, but that so what test, as you mentioned, just wasn't really addressed. And I think that's just so crucial. So are there any particular common pitfalls that you're otherwise seeing in submissions?
Common pitfalls, I think that obviously, like with a lot of papers coming through, we will see things like errors within tables, within figures. I feel like those are not perused by the senior author or the other people who are co-authors as carefully. Like everyone looks at the body of the paper very carefully, reads it very carefully. But for some reason at the end, maybe because they're so tired after reviewing everything, the tables don't get reviewed with as much rigor. And then the caption to the figures sometimes don't get reviewed with as much rigor as well. So those are, I think, areas for improvement. Other things that again, this is a little bit nitpicky, but I think that we should move toward is that most of the studies that are coming through, they are single center studies. And so if you look at our clinical colleagues, for example, for me, so I'm a cardiothoracic radiologist. I do most of my research in the setting of lung disease. If we look at the lung journals, for example, CHEST or American Journal of Respiratory Clinical Care Medicine, almost all those papers that are accepted, they have at least two sites, at least two centers. So one acting as a validation core. Some of them have 3 sites, right? Because if you just have a one center study, there's always a chance you're going to have bias within that study. And I would like to see us move in that direction. But in radiology, we are quite comfortable just having single centers. But I think in the next 5-10 years, we should move away from that and be more collegial, more collaborative in terms of creating multi-center research projects.
So anything else that you'd like for our listeners to know?
So I encourage people to submit more research letters. I think this is underutilized. And some will downplay these as less impactful than full research papers. But I actually think they're very nice ways to get smaller projects with more compact data into the literature. Also, I think a very nice opportunity for junior authors, for example, residents or early academic attendings, to try their hand at research projects on a smaller scale, so it's not as daunting. Traditionally, when someone was interested in getting their hands dirty in terms of academic productivity, they'd be thrown a case report or pictorial essay. And I think that has that role there. Obviously, you can practice writing, practice pulling papers, reading things, consuming things, and then writing in with your own voice. But personally, I think that it's better to try these research letters more, because if your ultimate goal is to create research, create more data, you might as well start with research on a small scale, because then it's easy to kind of grow that, because all those sort of skills, all that sort of practice, that muscle memory, it's the same thing. It's just on a smaller scale. And so when it's time to write a larger paper with more data, you already have that in your back pocket.
Yeah. And when we look at our journal metrics, a number of the research letters that we publish actually do really well in terms of downloads and citations. So, as the author thinking about exposure, visibility of your work, the research letters, they're out there and they definitely get that attention. So Jonathan, thanks so much again for joining us.
It was a pleasure. Thanks for having me.